So hi everyone. It's great to be back, and it's really good to see that we have you know, um, some walls between us and the crowd outside. But we'll try to speak as loud as we can. So today, the panel is how can health startups access more data to scale? And we have four great speakers. Maybe we can start off. Each one of you introduce yourself a bit, but I'm sure everybody knows you. But it would be great to have an introduction quickly, and then we can go through some questions.
Hi, everyone. Ahmed, founder and CEO of Whoop. We build wearable technology to continuously measure your body, to improve your health, your performance, important metrics like sleep, recovery, exercise, stress, and a lot more. So excited to talk about collecting data and AI today.
Great.
Hi, everyone. I'm Taylor Capito. So we at GenRait, which is my company, it stands for Genomic Revolutionary AI Technology. We're leveraging the power of AI as well as like cloud infrastructure and other cutting-edge technologies in order to advance, drug discovery and rare and chronic disease discovery research processes.
Awesome. Hi, everyone. I'm Morad. I'm the founder of FC Mother. FC Mother is a new type of company that's reimagined football clubs and sports clubs as public health vehicles, and excited to talk today about the importance of motherhood and what we can do when we get creative with data and apply it in novel ways for well-being.
Great.
Good
Josh?
afternoon. I'm Josh Fink. I'm the founder of Luma Group. Luma Group focuses...
There you go.
There we go,
There you
good. Sorry about that. Good afternoon, I'm Josh Fink. I'm the founder of Luma Group. Luma Group focuses on translating the most cutting-edge science in biology and using AI to make it cheaper, faster, better into game-changing novel therapeutics, diagnostics, and devices. We both build companies and help to grow and accelerate companies.
Awesome. So if each one of you can tell us what your company business is, and how do you generate true value to different customers and stakeholders from using healthcare data in your business, maybe from a story or some sort of real-life case would be great. Who would start? Will?
Yeah, happy to. So, look, Whoop is continuously measuring about 7 or 8 different biomarkers on your body 24/7. We collect all that data. We then summarize it in different scores, like a recovery score or a stress score or a sleep score. We then take that information, and on top of that, we look at to coach you around it. So you should go to bed at this time. You should wake up at this time. When you drink caffeine after 4 p.m., this is how it affects your sleep. You've woken up and you're run down. This is what you can do to get back in good health. And then the layer above coaching, which I think is ultimately the hardest layer in this entire space, is around health outcomes. So real behavior change. So it's one thing to tell someone when to go to bed or what to do. It's another thing if they actually do it. And so we're really in the business of behavior change and driving at health outcomes. So ultimately presenting people information, giving them real feedback, and then driving towards change. And you asked for a specific example, like people who are on Whoop, for example, for 6 months, they'll be more active at the end of that 6-month period. They'll be sleeping more. They'll have a lower resting heart rate. And so you can start to see the signs that wearing this technology and interacting with it every day is actually making people healthier.
Okay, great. Taylor?
Yeah, so everyone here has probably struggled with some issue with their health, particularly chronic issues. And we have 1 million medicines on the market. And yet, I think someone on a previous panel said exactly what I would have said, which is that the time horizon to discovery is like 15 years or more. And so we're not seeing these advances that could be unlocked in like pharma and wellness and diagnostics. And like for me, I think you said, tether it to a personal story. I mean, I got into this field. I used to previously be in cybersecurity, and I pivoted into the health space and into the life sciences space because I struggled with autoimmune disease. And I got myself healthier with just very little information of my genome. And I think of all the data points that are there, there's 3 billion data points in the genome. I mean, some of them are more useful than others, but that's a lot of information. And I noticed that with the existing methods and how this data is used, access in the field, and that's by no fault of any scientific researchers, other than the fact that the field has advanced so rapidly. I mean, the cost of sequencing has plummeted. These insights are not being uncovered. And so with me being a technologist and having a technical background, I thought, what can I do? And what GenRait does, what our current product does, is we're essentially like, if a researcher or a bioinformatician, which is the type of researcher that digitizes data, if they were the chef, we're like the fully stocked kitchen with the ingredients, with the tools, so they don't have to go to the supermarket. They can just start making things. They can start making analyses, start discovery. We've got the computational infrastructure, all these different things, commonly used tools, data, it's all there. And what we're building, though, next is a feature we're calling the BioNet. And it's going to start unlocking the predictive potential in the genome. So that's what we're doing at GenRait. Yeah.
That's a great story. Thanks, Taylor. And Morad.
Yeah, so, what's amazing about, there's a panel on data, and it's helpful to start with the most important data point in the world, which is that everyone in this room, I don't care where you're from, we all come from the same place, and that's a mother. And that period, that 9 months in the womb, is the most important data in all of humanity. And, people always ask me, why are you obsessed with maternal health? I've been on it 10 years. I founded a lab that's collected the largest data set in the world on maternal health. And they ask as though maternal health is like some separate topic. And when the truth is, the science tells us, and this new field of science, really, that maternal health and the 9 months of the womb are the greatest predictor for everyone's well-being sitting here today.
Yes.
70% of your brain is formed in the womb. About 90%, what is called fetal programming, occurs within the first 1,000 days.
Yes.
And so we've been able to link and correlate in our lab and publish, working with 8.4 billion data sets and records on birth and death, what the total value of healthy pregnancy is today. And we published this at Harvard, and the numbers are astonishing. We're losing 191 million life years every year due to unhealthy pregnancy, and that equates to $27 trillion, which is the size of the US GDP. So everyone working in health, well-being, longevity, really can look at this period of pregnancy and say, this is the golden window for actual interventions. And, I guess from a personal point of view, I'd been working on the maternal health side for so long, and public health moves in 100-year increments. It's so slow. And I worked in policy related to maternal health. I set up all these initiatives, and none of them worked until I went to the World Cup in 2022. And I'm a former pro football player. And there I was sitting with a world-class footballer. And a reporter asked him, you're one of the best in the world. Why does your mother still live with you? And he said, what did you ask me? And that's when it hit me that it was the football community who would understand this issue and be the messenger. It wasn't healthcare, it wasn't tech, it wasn't politics, it was football. Football is our greatest social vehicle. 5 billion fans, transcends religion, transcends politics. And so what we've done is really merge life science now within football, and that's how we're translating our data and insights.
That's great. I mean, we have a cybersecurity expert and then a professional football player. That's awesome. Josh?
The reality, as I see it, is that in order to focus your time, to focus your attention on improving human health outcomes, this is something that is relevant and pertinent to every single person in this room. Frankly, every single person on the planet. Everyone here has been a patient, is a patient, or will be a patient. And if we want to make patient outcomes better, you need to focus on data. There are so many buzzwords around healthcare, so many buzzwords that people use to raise capital, to promote things. But at the end of the day, data is fundamental to drug discovery. Data is fundamental to animal trials. Data is fundamental to human trials. And ultimately, data is fundamental to the sales and marketing of therapeutics and diagnostics, and is fundamental to patients. As we think about the future of medicine, we hope this future will be one that is imbued with personalized medicine. Each of us have different life experiences, Each of us have different genomes that express itself in different ways. But in order to have proper personalized medicine, we need to have personalized data. And this drives me. This is exciting because here you have the opportunity to disrupt a sector that's 20% of US GDP, 14% of global GDP, so a fifth of US GDP. You can generate trillions of dollars of enterprise value, but at the same time, you can make a demonstrable difference to all humans on Earth.
Great. So that goes, leeway into my second question is, how do you like the quality of the health data you're working with? And tell us how important data quality is and your effort to improve the quality of data. And then also, what type of support do you need from regulators to make it happen? Josh, would you like to start?
The health data, as mentioned, is so fundamental. And the opportunity for AI to utilize health data is monumental, can be absolutely transformative. At FII, there's a lot of discussion about AI. And AI, no doubt, will be one of the most profound, if not the most profound revolutions in human history. But at the end of the day, if the AI model can't get good human data, it's worthless. It's garbage in, garbage out. And to get great human data, we need, biology is very complex. And to get great data from something that's inherently so complex, we need to be able to have standardization of data. We need to be able to have anonymization of data so we don't violate HIPAA laws or patient privacy laws. We need to have lots of data of one patient over time. At any one given moment, there's millions and millions of data points in your body, and you need to see how those data points change over time. So the potential here for data is huge, but the complexities here are massive. I think we can overcome it, but to overcome it, we will need the standardization, and we will need one other thing, which is security. If all of our data is sitting up there on the cloud, the potential for cyber attack, is very, very large. We need to have better cyber protocols. We need to utilize AI for cybersecurity of health data.
I mean, I'd love to weigh in. And you said it, Josh, garbage in, garbage out. So one of the things that I'm noticing looking around at this conference, how many different regions, how many different countries. I mean, there was a whole Horizon Summit, there was New Africa, everything's here, right? And a lot of our data that we use as the basis of this research, particularly in health, is not. It's not representative, and it's not representative. Morad, you talked about, life in the womb and the epigenetic effects of that. I mean, just in daily life, even your region and where you live can make a difference in your gene expression and your health outcomes. And we don't have these very robust catalogs of this. And so one of the things that really needs to be met is, more diversity in the research and in the data sample sets, and we need to come together for that. And I love conferences like this because of that. It's been awesome to see all the research initiatives here. And then, governance of that. So we have 1 million LLMs now. AI's everywhere. You can't escape it now. I see billboards. I never thought, coming out of tech, when I founded my company, I put AI in the name. People thought the name was weird. And I never thought that, fast forward just a couple of years, and I would see billboards driving down the street that said AI.
Yeah.
And you can't escape it now. It's everywhere. It's ubiquitous. And yet, we have no governance on what's going into it. And so model governance, I think, is going to be one of the next really big things. Understanding, which can get recursive, because are you using a model to train the model governance? But we won't go there. But there's all these new horizons for technology ingenuity. I don't even want to look at it as a negative. These are new markets. And it's so exciting. And coming out of a security background, cybersecurity background, what Josh said is so true. On the data, at the patient side, at point of care, and securing and protecting the data is vastly important. I want to go back to governance, though, upstream. I mean, the only way that you can protect the input of a model, once data's in an LLM, we know this with ChatGPT, when, trade secrets were leaked. Once data gets into that model, it's there, right? It's part of the training set. And so governing what goes in from an anonymization perspective, from a standardization perspective prior to it going into the AI model, whether that's an LLM or a neural network or some other type of model, is really, really important in order to prevent not only poor data coming out, but information leaks.
Yeah.
And so these are kind of the things that I think about when I think about
Great.
data.
And that's how we'll get to a multi-omic future.
Yes.
Yeah, I'd love to point out kind of in a different direction the layer of data that we focus on. So there's this pie chart that's been floating around from the WHO, and it shows the stack of well-being, and it shows 70% of our well-being is derived from our social environment. 10 to 15% is our genetics, 10% is our behavior, 5 to 10% is our healthcare. And so if you really wanted to move the needle on well-being, you'd focus on the largest chunk of the pie chart, which is the social determinant of health, the social layer. And so this social determinant of health layer, to me, is this untapped, incredible opportunity. And from a point of view of how do you collect social data? If the large majority of health is from social factors, then the large solutions are in the social sector. And so I think that part's unaddressed a lot. And I think it's unaddressed because it's not defined yet. If people understood this is the sector, this is how you distribute, this is how you actually structure, and that's really what we're trying to do. But I think the point of untapped high-value gains is really in the social determinants.
Will?
Yeah, I would just add that, from my perspective, like having really accurate, diverse data is the key to enable a lot of the one-liners that sort of people refer to about how AI is going to transform healthcare. Like you have to have some underlying data set, and it's better if that data set is continuous and accurate. It's interesting, for example, that Apple Health, which has an enormous level of data, like all sorts of different data points from lots of different products, what's the most valuable business that's been built on Apple Health? It's kind of a trick question because, in fact, no valuable business has been built on the back of Apple Health yet, which, if you think about it, is kind of a staggering fact given how many things seem to be plugging into it. So why is that? Well, I think part of the challenge is that these data sets are non-continuous, at times accurate, at times inaccurate. And so you've got like all these different numbers and not necessarily a coherent use case for them. When we were in the very early days of starting this company, a lot of people, specifically investors, said to me, look, you don't need to build your own hardware. You should just really focus on collecting data from these different sources and build the software. And I have to say, I'm so glad we didn't do that because by building our own hardware and our own technology, we've been able to control every layer of the analysis. And to be able to actually have that data set that comes straight off the human body, we're now in a position to actually truly understand what's going on versus having to rely on someone else's data to try to parse through what's going on. And the other thing I would say, just in terms of the diversity of the data, this is a fairly staggering statistic, but 97% of all medical research globally has been done on men.
Yes.
3% women, 97% men.
We talked about that yesterday.
That's a pretty staggering statistic. I couldn't believe that when I heard it. And so, at Whoop, we've pledged that 50% of our research is going to be allocated to women, 50% to men.
Great.
Right thing to do, but also just makes practical sense if you're trying to build a data set to really understand humanity.
Oh, that's awesome.
Go ahead. One more thing. So when you were talking, it was inspiring me. Like one of the things, it's also collaboration. I think it's going to be one of the next priorities. You can't solve everything at every nexus of healthcare or life sciences. And we have so many people here doing disruptive things that they're generating different data types.
Yes.
Well, real predictive modeling in health and expression is how do you bring those different types of data and different data sets together? Like, I think a future is where like biometric data is joined in with omic data. It's joined in with, the unstructured notes from a provider. Sorry for whoever has to figure out the structuring method for that. But all of these all of these things I think will be brought together, and that the collaboration of the different people in the industry is going to be a key point. The collaboration of different regions, I mean,
Yes. Yep.
huge.
Exactly. So my other question is, and I think, Will, you answered that a bit, but I mean, today, this session, this whole FII, it's all about AI. So what is the role of AI in assessing and processing the health data? Is one. And how does a healthcare startup incorporate AI in your daily operations? And the third one I actually have is, a lot of times when because we also invest in a lot of AI healthcare companies, and I would tell them, look, you guys better run and run very fast, because there are all these LLM companies, there are all these Googles and the likes, XAI. They raise so much money and they have such great processing power. When they start going into healthcare, they're going to catch up with you so fast. So what can you do to make sure that you have a real competitive advantage that you can maintain? Anyone
Well,
like
I
to
would
start?
I would just say that a lot of it comes down to the data and how unique your data is.
Yeah.
And it's in my opinion that over time we'll just see a lot of these large language models be commoditized.
Yeah.
And sure, maybe there'll be 4 or 5 players that are enormous companies, but the responses that you'll get from them will largely be the same. And what will be unique is the data. And so you're already seeing this where large language models are paying for unique data sets to train on. And so the way at least we think about it is, how can we create the most unique data set to empower this layer of AI, which ultimately I view will be commoditized.
Philip?
I mean, yeah, data is a huge differentiator. How you train the model is what makes the output good. It goes. I hate to keep going back to garbage in, garbage out.
Yep.
If you put good quality data in, the data outputs will be good. You asked a series of questions, though. You also asked, how do healthcare startups incorporate AI into their daily operations?
You can choose whichever end you want to answer.
I mean,
Give you an option.
So how does AI distinguish itself? Data quality. Not every AI type is an LLM. So there's other types of AI that can be utilized. There's areas where AI can be utilized in a workflow. So we're leveraging AI at GenRait for results interpretation and for aggregation. So that you don't have to reinvent wheels. Where we're building is upstream in the data standardization process, right? In the genomics, but then ultimately multi-omic relationship stage, where then we can work with other AI solutions. And again, it can be a collaboration. For those of you that know game theory, I'm a huge stag hunt person, right? But if you don't know it, Google it. It's 1 + 1 = 3. We can work together and achieve bigger results. And so this is like day-to-day operations. Where do you incorporate AI into your flow? Well, if you're an AI company, if you're creating AI and your engineers aren't leveraging AI to streamline their own development processes, then you're doing something wrong, because then you're not living your words. I mean, we try to incorporate AI at various stages at GenRait. We were just using AI. My co-founder, he's a genius, ex-NASA. I worked with him at Palo Alto Networks. His name's Shantanu. He just leveraged AI to do some of our market research for me, so I didn't have to think about doing it. It's like you can use it, we can scale ourselves now.
Yeah.
It's brilliant. So in day-to-day operations, whether you're a healthcare business, whether you're a service company selling flowers, you can leverage AI in your day-to-day operations, and you should be doing what you're marketing and trying to automate yourself, trying to scale yourself up into deeper decision making. And then as a collective, we will become a society where suddenly we are colonizing Mars and going out into the stars and have predictive modeling and genomics. And this is reality that we can have if we keep on this trajectory. So yeah.
Great. Morad?
Yeah, I just want to make a comment on Will's point on these blind spots related to women's health. When I wanted to set up a lab or partner with a lab, when I started learning about maternal health, and that time I had a lab at the Mayo Clinic. I went to Mayo, Stanford, Harvard, name it. I want to work with your lab. They said, we don't have a lab. And I said, every human comes from this place. Why aren't we studying it?
Right.
How could we not have a lab on pregnancy?
Yeah.
And so that was number one. Number two, what is the gold standard for a healthy pregnancy? A very simple question. Nobody could answer it. How could we not have a gold standard on prenatal health, on how to create a human life?
Yeah.
We have standards for everything on the planet. Humanity doesn't work without standards. It's just a common language. We can't land an airplane without a standard.
Yeah.
Can't do open heart surgery without a standard. And so creating the first standard, and so we've seen these blind spots over and over and over. And what's fascinating is that all of this is just untapped right now. And I think the gains we'll get once we start organizing the infrastructure with the analytics is going to be profound.
As a woman, can I just thank both of you for studying women's data? Thank you.
Yes.
Happy to.
Awesome. Big support. Josh?
Nisa, I think about your question from two vantage points. On one hand, as investors, as builders and scalers of companies, companies need to embrace AI. If they don't embrace AI and data, we don't invest in them. For some of them, that means AI-first companies, but for others, it means they're biology-first companies, but biology-first companies that bring in bioinformatics, that bring in data science, that try to improve their workflows through the use of AI. This is critical. If the companies are not doing this, we won't invest, because I think the world is going to go to a world of haves and have-nots, and the haves will be the ones with the great data that are utilizing the AI. The second aspect of your question was touched on a bit earlier, which is the future in biology is really one of multiomics. But to have a future of multiomics, we need consistency of data, we need diversity of data, we need depth of data, and we need consistency of data. If we could get there from a data standpoint, the possibilities here would be absolutely endless. We could achieve a reality in a future where we eradicate almost every pervasive disease that afflicts mankind. But to do it, we need to get the data right first.
Well, we only have 2 minutes left, so I want to ask a very quick question, 30 seconds answer for each. So now that we're in Riyadh, what would you like to achieve? I mean, what's the purpose of your trip here, and what would you like to achieve with your company here on this trip and, you know, in the next couple of years? Will?
Well, I'll say this. I first came to Riyadh 20 years ago, actually, believe it or not. My dad's Egyptian. I tagged along on a business trip. And, you know, honestly, at the time, there wasn't a lot happening. At least that's what it felt like when I was here. And I came 2 years ago for FII, and I had a bunch of meetings while I was here. And there was initial seeds of people starting to wear Whoop in the Middle East. And I was blown away by just the overall optimism for the future. I mean, truly, the energy in Riyadh, and I would say broadly across Saudi Arabia, is palpable. And there's just a general sense that tomorrow is going to be better than today. And of course, that comes from leadership. And, you know, we've found in the last 18 months that this region has become one of our fastest growing regions. And I think it's because they care about health, they care about tech, and you know, you have conferences that are focused on AI. So I'm very excited about the overall region.
Great. Taylor?
Yeah, so it's not too often that you get to come to a global stage of this scale. And it's also not too often that you get to see this amount of progress happening this rapidly. And similarly to you, Will, I was noticing like new development everywhere. I talked to people from Neom. It's so incredible. So in the United States, and I'm going to try not to go over, in the United States, we have policy bogging down the application of a lot of these use cases that are going on here in Riyadh right now. Because it's blue sky and it's greenfield. And partnering with people applying these amazing technologies would be a huge thing that I would like to do. Evolution, Neom, so like impactful what you're doing. And then also just anyone who wants to support, learn more, mind share. I came here to collaborate. Yeah.
Morad?
Yeah, we're here announcing the formation of a new sports league to help solve maternal health. That'll be tomorrow. The whole goal is in 10 years to have the World Cup of Healing held here, to help heal our mothers, and to have the largest longevity gains recorded in human history purely by harnessing the exponential force of pregnancy. Heal pregnancy to heal humanity.
Awesome.
Thank you.
Josh, you have the last word.
I think at a meta level, the big opportunity here in the kingdom is to implement value-based healthcare. In the US, it's a fee-for-service model. The more operations, the more tests, the more procedures the doctor does, the more the medical system gets money. It's not about curing the patient. And here in the kingdom where you have a blank slate, the North Star should be value-based care. The North Star should be making patients healthy. The North Star should be preventative health care, keeping patients healthy before they even get sick. Huge opportunity for the kingdom.
Well, let's, thanks for such a great kind of discussion, and let's give a big hand to our panelists.
Thank you, Nisa.
Thank you.
Yeah, thank you.
Okay.